So, continuing, Maintenance and Welfare of Parents and Senior Citizen Act 2007. So, major objectives of this are revocation of transfer of property by senior citizens in case of negligence by the relatives. So, if the relatives are taking the property of the senior citizen, we can reverse that particular act. So, maintenance of parents or senior citizen by children or relatives made obligatory and justifiable. Pension provisions for old age, adequate medical facilities and security for elderly, establishment of old age homes. So, this act support all these objectives. Is having these objectives. So, that is Maintenance and Welfare of Parents and Senior Citizen Act 2007. So, coming to the third part, various policies and programs of central government for elderly. So, in that, this Maintenance and Welfare of Parents and Senior Citizen Act also included. So, National Policy on Older Person (NPOP) in 1999. So, major components of this policy was support for financial security, healthcare, shelter, welfare and other needs of older persons, protection against abuse as well as exploitation, opportunities for the development of older persons, improving the quality of life. So these are the major components of national policy on older persons. See, there is no need of explaining all these points unnecessary. There is no need. That is the thing. You can just study what are the components in this. So there is NPOP, Agenda for Healthcare for the Elderly, the geriatric ward for elderly at all district hospitals, treatment facilities for chronic, terminal and degenerative diseases, providing improved medical facilities at community health centers, PHCs, mobile clinics, inclusion of geriatric care in the syllabus of medical course, including the course for nurses. So according to this act, we are studying, you guys are studying this topic, geriatric nursing. So reservation of beds for elderly in public hospitals, training of geriatric caregivers, research institutes for chronic elderly diseases such as dementia as well as Alzheimer's. So coming to the Maintenance and Welfare of Parents and Senior Citizen Act 2007, that is the same thing we have just studied. It is also included in the central government actions or services. So moving to the next program. So National Program for Health Care of Elderly, NPHCE. It came on the year 2010. Main vision was to provide accessible, affordable and high quality long-term comprehensive and dedicated care services to an aging population, to promote concept of active and healthy aging. So these are the vision of this program. There are some strategies. So see, in 2010 it came forward and now so many update also is there. So in community level, these are the core strategies. So in community level, domiciliary visits by trained health care workers. Domiciliary visits means home visits. So PHC, CHC level, there should be adequate equipment, proper training should be given, additional human resources if needed in the CHC, as well as information, education and communication should be maintained. In district hospital, 10-bedded ward for geriatrics and additional human resources should be provided. 8 regional medical centers should be there. In that, PG courses in geriatric medicine should be upgraded as well as a training should be provided. 8 regional medical center. Then IEC, information, education and communication using mass media, folk media and other communication. So these are the core strategies of NPHCE. There are supplementary strategies for NPHCE, that is promotion of public-private partnerships in geriatric healthcare, mainstreaming Ayush and convergence with programs of Ministry of Social Justice and Empowerment in the field of geriatrics. So here, just find out what is the full form of Ayush and message me. Reorienting medical education to support geriatric issues. So these are the supplementary strategies for NPHCE. See, so many programs as well as privileges we are studying. So all of these things is not able to remember in an easy way. So try to make some code and remember these things. Then coming to the services which is provided at the subcenter, PHC, CHC, all those things. So first one, services at subcenter. Health education related to healthy aging. Domiciliary visits to home-based bedridden elderly person. Linkage with other support groups and daycare centers. Arrange for suitable supportive devices. So what explanation can be given here? Nothing. So these are just specific points you should study. Services at subcenter which is provided for the older age group.